This episode is brought to you by Banfield Pet Hospital and proudly sponsored by our friends at Zoetis, whose team of pet lovers, scientists, veterinarians, and more have dedicated over 70 years to advancing pet health.
Your call has been forwarded to an automatic voice message system.
Hannah Shot.
Is not available. At the tone, please record your message.
Hi, Hannah. This is Henry from Atlanta. I just got a new puppy, and I'm a little overwhelmed by the vaccine schedule my vet gave me. There's so many shots listed, and some need to be repeated. Can you help me understand why all these vaccines are necessary, and how are they going to actually help my dog's health in the long run?
Vaccines are one of the most powerful tools we have in preventive care. And as animal lovers, we all want to make sure we're getting the right care and the right protection at the right time. But figuring out what's necessary and what's optional can feel overwhelming. So today, we're unpacking vaccination with Dr. Marissa Rothenbaum, Director of Veterinary Field Programs at Banfield Pet Hospital in Portland, Oregon. With more than 14 years of experience, she's here to break down how those vaccines actually work, how an animal's lifestyle shapes their vaccine plan, and why those puppy and kitten series require multiple visits. Whether you have a brand new cat or dog, or if you're someone who has been through your fair share of checkups, I hope this conversation will bring clarity. Dr. Marissa, thank you for being here.
Thank you so much for having me, Hannah. It's great to meet you.
Really excited to chat with you. Today, we're talking about vaccines, which is just such an important cornerstone of preventive medicine. So, I want to start with the basics. I think a lot of people have a general understanding of how vaccines work, but can you walk us through what is actually happening in the body of an animal after they've received a vaccine?
So, if you think of it in terms of production like a play, you are often rehearsing. So, you have these basic rehearsals beforehand. Closer to the show, you get a dress rehearsal, and then you have the big show. So, when we think about how vaccines are working, they're essentially those rehearsal moments where the body is prepping and getting ready to fight what could be the real infections. But more broadly speaking, most bodies are able to process these non-infectious elements of a disease-causing agent and build that immune response. Then, if in the eventual case that yes, you are exposed to whatever it is that you've been vaccinated against, your body already knows how to respond. They can get on that stage and run that script, and those white blood cells are able to curb any sort of infection from causing a more significant infection, or in some cases, it completely prevents infection at all.
I know that there's different forms of vaccines, and you hear about things like modified live or killed vaccines. Can you talk about the difference and how does a veterinarian decide which of these to be giving to the patient?
Of course. With the different types of vaccines that you hear about, modified live, attenuated live is another term that you might hear for that, killed live, those are all referring to the ways in which the organism is being introduced. In some cases, it's the whole organism and they've killed it. That's the killed live vaccine type. And your body still sees it, but it's not in a state because it's been killed to actually cause and promote a full infection. But the body can still say, ooh, that's not one of my normal body cells. I need to go address that and will still mount an immune response. Other ones, like the modified live, there are other types of vaccines as well. They may take a piece of an organism and introduce that into the body. Another means of getting the body to respond to treat the infection or build immunity against the infection without introducing a disease causing agent that can cause the infection itself. In terms of selecting the vaccines, it is dictated by the science behind it, the research, the evolution of the disease itself. What the body is specifically responding to may vary. So, in some cases, a piece of a virus won't be enough to mount that immune response. So, that would not be a good candidate for one of those ones that takes a piece of it to prompt the immune response.
Yeah, absolutely. And it seems like, immunology and vaccine science is sort of always evolving also, right? I would love to hear you talk about how you've seen the field change over the years that you've been doing this work, and what that progress means for animals today.
There is a lot of research, and science constantly is exploring how to do it differently, how to do it better, how to prompt the immune response more safely or for longer. We also don't have permanent immunity for some specific organisms, viruses being a common one, because they mutate so quickly. So, the mere fact that we're able to understand how a virus is mutated and basically reformulate a vaccine to match it is certainly really exciting, just because it's that progress, it's that advancement. The other thing that has changed just in the time that I've been in clinical practice is the frequency of vaccines and how long immunity is good for. These recommendations are research backed. And we here at Banfield, for example, we refer to the AHA guidelines, which is the America Animal Hospital Association. They are one of the organizations that helps to define what some of these guidelines are. What this means for our patients and our pets is that they are hopefully getting vaccinated as often as necessary to protect against disease. The other big advancement is the types of vaccines. So, the mRNA vaccine, for example, is something that we talked a lot about, especially with the COVID vaccines. There's lots of different white blood cells that are active in our body, different ways that antibodies are working in our system to fight disease. And some of these newer vaccines are able to trigger multiple versions, variants, or different cells or players in the larger immune system to protect against the same agent. So things that they're going to be exposed to more frequently, you kind of have a double defense, or in some case, a triple defense against whatever that disease causing agent could be.
It's so exciting to think about how the science is changing. And certainly, in our lifetimes, I think that there's already been a lot of great impact from vaccines. Are there any diseases that the veterinary field is kind of seeing fewer of because of good vaccination programs?
Fewer of is a bit of a relative term, and this starts to get into access to veterinary care, which is certainly very near and dear to my heart, making sure that we're able to serve communities that need it. But where we have access to veterinary care and pets are vaccinated routinely, we see less of canine parvovirus, for example. That's a very, very big one. That's the one that everyone has in their head. I can't take my puppy outside until X number of weeks or months of age so that they're not getting exposed.
Absolutely. Yeah. I mean, it goes to show the impact on everyone when we have access, and when preventive medicine is being approached, for the entire community. I love that you brought up puppies. I am a neonatal kitten and puppy rescuer myself. So when adopters come to pick up a kitten or puppy from me, sometimes they're surprised that they actually need to continue doing more vaccines, even though this kitten or puppy has already received, a vaccine or two with us, that they need to continue those for, 1, 2, 3 more times. So, can you talk about why in these younger patients there can be a booster series, and what people should be thinking about if they've adopted a new kitten or puppy? How important is it that they really do go to those follow up appointments for those boosters?
With our puppies and our kittens, especially, oftentimes they have some immunity. It's called passive immunity or maternal immunity or maternal antibodies that come from their mother. It's either shared or spread to them when they are in utero through the blood, or when they are nursing through the mother's milk. And that can convey some immunity. And then if you give a vaccine too early, then the body doesn't actually respond to that vaccine, because the active immune cells, courtesy of mom, those antibodies, are doing their thing and building their own immunity that will then last. Other factors that will affect this are also the type or the nature of the disease that we're vaccinating for. In some cases, we want to start them earlier to have that layer of protection on top of what may or may not be present from a maternal antibody perspective.
Hmm. So let's chat about people bringing their animals in to see you for vaccinations. I think that it can be intimidating for the average person who is bringing in their new cat or dog. Sometimes they can be confused about core vaccines and non core vaccines. Can you explain the difference and how you evaluate different risk factors or different needs of the specific animal you're seeing to make a recommendation for them?
When you're first bringing any pet in, exposure to parasites is also another thing that you'd want to make sure that you are talking about because, yes, we're talking about vaccines today. And another significant element of preventive care when we think about the role of the veterinarian, when we think about zoonotic diseases that can be transmitted from pets to people, parasite control is also really important. And core vaccines are the things that we know based on disease processes, how diseases are transmitted, how you might get exposed, that every pet should have at least the initial vaccines for. But oftentimes, those are the vaccines that are going to need to be repeated throughout their life as well. Most commonly, of course, your rabies vaccine, which is a requirement in pretty much every state, county, city, etc., because of the significance of that disease for people and pets. Even that tiny little purse dog that lives in a high rise is still going to have risk of being exposed just as they go about their day. And again, thinking through the lens of leptospirosis can be transmitted to humans. We want to stop it where the pets, or sorry, we want to stop it at that interface between the wild carriers of the disease and the humans, which is our pet population.
I do want to ask you about rabies vaccination, which, as you say, is legally mandated in most of the United States and is strongly recommended everywhere in the United States. Can you share why that is so important, and also kind of like the implications if you don't have a current rabies vaccine?
It is very highly fatal when a human is infected. Additionally, the treatment, if you have been exposed, is intense. It's multiple vaccines, injections in your abdomen, like all sorts of things, because again, with the high level of fatality or what we call mortality risk associated with it, we try to like pull out all the stops and treat someone as soon as we know that they've been exposed. Our pets are the most likely to encounter them directly. Dogs are off doing their thing. They're hunting, they're out in the woods, like that working Labrador that I talked about, and they may be exposed to an animal that is already infected with rabies. So, that is a very easy way for us as veterinarians through a One Health perspective, where we're thinking about both human health and animal health simultaneously, that we're able to prevent the spread of rabies into the human population.
Yeah, and I try to remind people too, like it is important for them to have the vaccine, but it's also important for you as somebody who wants to protect your animal to have the record of the vaccine because, heaven forbid your cat or dog does bite somebody, you are going to be required to present that record. And so this has been a real personal journey for me trying to figure out like what is the right vaccine schedule for her. I know that living here in California, we do have a lot of increase in leptospirosis along the coast, which really, makes me scared to take her out hiking or things like that without vaccination. How do you help people who have kind of like these other health concerns navigate? How would you advise somebody like me with my dog Birdie, where there is some risk?
What are the risks associated with a vaccine with concurrent conditions? So, other diseases, illnesses, other situations happening within your pet's body. We always want to think about what are the immediate risks of administering a vaccine and then compare them against what are the risks of that pet or patient being exposed to whatever it is that we're trying to vaccinate against. So that's where I would then engage with you in a conversation about here are the potential side effects. Knowing epilepsy is often what we call idiopathic. We don't always know what's causing it. Do we know that a vaccine is going to trigger a cluster seizure? Not necessarily. Can we also preemptively get ahead of her seizures, increasing her dose of an anti-seizure medication, or making sure we're monitoring her that day so that if she does have a seizure, we're able to address it in the hospital rather than you having to worry about it at home. So we can mitigate some of the risks that happen with the vaccine itself. But it all boils down to that conversation. And that conversation is founded on a relationship with your veterinarian, understanding who my patients are, my clients are, is really important to me because that helps me do my job better.
Yeah, I really appreciate that because I think having a good relationship with your veterinarian is so important and feeling safe to be honest. I never even talking about with Birdie, I don't ever want to sound like, "Oh, I don't want to do this thing that I know needs to happen," but I think it's important to be able to talk about, what are you trying to do? What are your concerns? And to that point, I wonder if you can talk a little more about, like, is it normal for people to come to you with some fear, if they've maybe heard that there could be side effects from vaccinations? And how do you help people? How do you frame those risks and help people feel comfortable with something that ultimately is such an important piece of preventive care for their cats or dogs?
It is so common for people to have concerns. And there are certainly truly breeds that are at greater risk for vaccine reaction. And those are the ones that I'm going to double down on. Like, let's talk about your risks. Let's talk about adjusting your vaccine schedule. We may spread them out. We may, you know, maybe it's like alternating every couple of weeks and we do one and we just like get the whole series done, or we do one whole series. And if it's something that can wait, like leptospirosis is not really a high risk, maybe we can do that after we've finished the distemper parvo series or rabies. So there's things that we can talk about in terms of, again, mitigating the risk. But when we talk about the risk, it is a cost benefit analysis, similar to the conversation of Birdie of like, we could give her this vaccine. The benefit of it is that you get a little bit more comfort going about living your life with Birdie, who's meant to be your like, adventure ready companion. And then the more immediate risk is this risk of increased seizures. And we would just talk about how does that balance out. My job as a veterinarian is to provide you with the information that allows you to provide what we call informed consent.
I want to talk about indoor cats. I think some people kind of wrongly believe if your cat doesn't leave your house that they don't have a risk of exposure to disease. And of course, you and I know that lots of disease can travel and it can come to you. You don't have to go to it. So, can you talk about that, particularly with things like panleukopenia, which are so prevalent in the kitten population? Can you talk about sort of the risk even to indoor cats and what you would recommend as a vaccine schedule for people who do have a cat that is strictly indoors?
You mentioned panleukopenia, very similar to parvovirus. It's one of those ones that we have this opportunity to make sure the adults are all vaccinated. And the reality is, indoor cats can become outdoor cats real fast, even if it's only for a little while, but it happens. They sneak out, they get out there, and the risk of being what we call an immunely naive animal out in a world where you're all of a sudden like nose to nose with new cats that you've encountered on the street, it's very helpful to have that immunity already in place and to be maintaining that immunity.
So once an animal is an adult, let's say they got their all their vaccines as a puppy or as a kitten and now they're an adult, how often are you advising that people come in to repeat those vaccines?
The booster schedule across the pet's lifetime is going to also be informed by their risk to some degree, but there are, like with rabies, requirements every 3 years. Once you hit that, after you've done your first year of it, then you can go to a 3-year cycle for most adult pets. So there are some that you can stretch further. Distemper, parvo, and FERCP for our cats also can become a 3-year vaccine. But then also based on the manufacturer's guidelines, you may have to repeat every year. So leptospirosis, for example, is one that requires an annual booster to ensure that the pet is truly protected against that.
Hmm. And I'm hearing that there's a growing interest in titer testing. Can you talk about what that is? How does it work? And are there limitations to that? Is that something that you recommend?
Yeah, so titer testing certainly is something that you'll hear about if you have ever tried to travel with a pet into certain states or countries where they want to be sure that a pet is protected against a specific antigen. So, the most common one that I have dealt with is, of course, rabies, because, as we have mentioned, the significance for human health as well makes that a very high interest pathogen. So, titer testing is going to take a blood sample and they will look for how much of an immune response is mounted against an antigen when exposed. So, the benefit of titers are, especially for pets who may not be great candidates for as frequent vaccination, is that you can run a titer. It is less invasive or maybe less likely to cause side effects or other reactions. And we can confirm that the pet is protected.
How do you help people catch up? If they haven't had, if they haven't been able to keep the vaccine schedule, what happens for them if they come in for the first time in a while?
What is the time frame? How long ago was it? And then the manufacturer's recommendations often require, even for adults, that they get at least two vaccine boosters, roughly 3 weeks apart, to ensure that they have appropriate immune response to whatever it is that they are being vaccinated against. So I would say, do not be surprised if the recommendation is to have some vaccines repeated in that first return to veterinary care and getting the pet up to date.
Well, I really appreciate you saying that because I think sometimes people feel nervous to go in and get up to date, but there's absolutely nothing to be ashamed of. Like anyone who is thinking about coming in and seeing a veterinarian, I encourage people just have an honest conversation and you'll feel so good having everything up to date. I want to move now to a segment we call Quick Pause. This is going to be like rapid fire questions. So just answer the first thing that comes to your mind. My first question is, if you could trade places with any animal, any species of animal for a day, what animal would you choose?
I'm going to get very specific here, but I would love to be a dog that is owned by a retired couple who lives on the coast specifically, because it means walks, it means naps, it means snacks, and being on the beach, ideally, when I think of walks that way. But just our dogs in particular, I think, like, live such wonderful lives of just like cruising around, doing cool stuff, being outside and sleeping.
I love it. I love it. Okay, my next question is, what is a vaccine myth you wish you could erase completely?
Not every animal or human needs the same schedule. So I think we've talked a lot about a lot. It like boils down to this conversation. So they are worth doing, and if you have questions, ask and have a conversation to make sure that they're able to meet your pet's needs and also be able to meet your needs as well.
Okay, what is one small act of care that you do in your profession that always feels really big to you?
The experience of euthanasia. And this is a thing. So often I hear people who hear I'm a vet and they're like, oh, I wanted to be a vet, but I couldn't do the euthanasia part. And I have always viewed that as a gift, that last act of compassion, being able to say goodbye and doing that with as much softness and kindness as possible. And I will admit that most of the time I too would end up with a little bit of tearing and sadness, but that to me is paying that honor to that pet's life and that relationship that that pet had with their family. And for me, it was the human animal bond that drew me to veterinary medicine in the first place, because our pets play such an incredible role in our lives. And that moment of it's severing is a very harsh word, but like ending the active relationship is so delicate and sensitive and can be just so beautiful and um, be viewed positively.
Yeah, and a vet plays such an important role in that experience. So I actually really respect and love that answer. Um, okay, if you could design a new vaccine for animals today, what would it protect against?
Stress and anxiety, which is not really how vaccines work. I recognize that. Like we've talked a lot about how they work, they don't work this way. And when so personally, I have had two dogs in my lifetime, and I'm currently 0 for 2 for a dog that does not have some sort of significant anxiety issue. Separation anxiety with the first one, generalized fear-based anxiety with the second one. So I would love to like resolve that for my dogs who would otherwise have an incredibly cush life, but they're just so stressed about literally everything all the time. But also when I look at animals that end up being rehomed, and this probably resonates with you, just being in more of the rescue and adoption space, is that a lot of our pets are rehomed for behavioral issues that most often have some sort of underlying stress or anxiety. So if we could rid them of that, maybe the cat wouldn't pee outside of its box and be a candidate for being rehomed, or maybe a dog wouldn't be have separation anxiety and not be able to be left at home without their parents for you know more than 2 hours at a time.
I support this
Yeah, let's
vaccine.
do it.
Let's fund it.
Yeah.
Let's figure it out. And then one for humans after that.
Yep.
Okay. Last question. What is one word, just one word, that captures what you love about your profession?
Connection.
I love it. Thank you, Dr. Marissa. This has been really educational. I learned a lot, and I really appreciate you being here with us. Big thank you to Dr. Marissa for helping turn what can feel like a confusing list of shots into something we can all understand. What we heard today is that vaccines aren't just a checklist. They're tailored care that ensures that the animals we love so much are protected against dangerous diseases. Hopefully today gave you a clearer sense of the why behind each step and the confidence to talk openly with your vet about what your individual animal needs. If you enjoyed this episode, be sure to follow for more. Thanks so much for listening.